Hartford Healthcare. As always, even before I get into that, just want to take the time to recognize all our frontline staff members. I want to put some focus today on our EVS group. I think they have contributed significantly to our process over the last few weeks. I think there's so much from a medical health community that, when this started, there were so many unknowns. But what we did know is that we need to ensure that there's appropriate infection prevention processes in place, and a huge part of that platform has to do with the work that the EVS staff members do. So I definitely want to, as always, focus on all our frontline guys, but definitely I want to spend some time focusing on EVS as well. All right, I'll talk about the numbers, and we continue to see a decrease statewide, so it's really good. So for Hartford Healthcare specific, for Behavioral Health Network, we're at 7 positives right now with 22 PUIs. For Charlotte Hungerford, we're at 9 positives and 10 PUIs. For Hartford Hospital, we're below 100, so we're at 99 at this point with 60 PUIs, so that's 60 patients being investigated for COVID-19 at this point. For Midstate Medical Center, we're at 11 positive with 14 PUIs. St. Vincent Medical Center, we have 67 positives and 28 PUIs. Hospital of Central Connecticut, there's 23 positives and 33 PUIs. For Wyndham Hospital, there's 4 positives and 13 PUIs. So total from the inpatient perspective, or inpatient basis, the total inpatient patients that we have right now, we have 220 positives patient that we're caring for at this point, and 180 PUIs that's being ruled out, or other diagnostic procedures are happening in relation to COVID-19. More on the outpatient side, so Behavioral Health Network, there's 4 positives and 1 PUI. And one number that I speak about whenever I'm here is Community Health Network, there's 229 positives. Again, this represents patients that's been transitioned through the Hartford Healthcare acute care system and is now home and getting care still with Hartford Healthcare's Community Health Network staff, very good staff, and 28 PUIs from in that area as well. So overall total footprint from a patient perspective with COVID-19 at current time, we have 453 COVID positive patients throughout the system and 209 that are PUIs right now. When this started, or when we started having a focus on this months ago, we spoke about our unwavering commitment to the safety of hospital safety. And what this means is not just the safety of our members within the hospital, but the safety of the community as a hospital respond to this pandemic and the community spread of it. And this is something that has not changed, obviously. It's something that we spend so much time on ensuring that this goes right. And that safety, that the effort that we put into ensuring that the hospital is safe is transitioned or translated into safety that ensures that as we move on or we pivot to accepting more patients, that safety can be seen and ensuring that all patients are safe when they come into the health system. And that's something we're looking forward to see more patients here in a very safe way. We have made significant strides in our inner city and urban testing. That's a significant priority at this point for a number of reasons, not just for an epidemiological perspective, but also to ensure that areas that have positive or areas that are unable to get into the systems now where testing is available, that we're getting to them, or we're reaching to these areas, we're reaching to these citizens just to ensure that the appropriate medical diagnostic tools are used and the appropriate treatment is being used as well whenever necessary. Another area, another place or community that we're present in now is the the Department of Corrections. So we're partnering with the state as to ensure that all population, to include the population within the Department of Corrections, have access to testing. So there's access to scheduled testing, to highest level testing that is we have available right now. So At this time, I'm going to introduce Dr. Benzoni. Dr. Benzoni is a pediatrician at Charlotte Hungerford. And I know there's a lot of questions, some questions we had a few days ago in regards to what we're seeing now is a pediatric syndrome that they're related to, based on a lot of studies, is related to what we think is COVID-19. So, Dr. Benzoni, yep.
Hi, thank you for having me. I'm Dr. Benzoni. I'm part of Hartford Healthcare Medical Group. And one thing I want to say that the testing in children, the PCR testing in children has been very limited so far. So children mostly are asymptomatic, and up to now we were testing only symptomatic people. But now that testing has expanded, and Hartford Healthcare is now testing children under age 12. So that's a big plus for us. However, what we're finding now with the children, we thought that they were getting off scot-free, and pediatricians and everybody felt very relieved because anything that hits children hits everybody harder than it does if it doesn't hit the children. So what we're finding though in some of the bigger areas that have had more cases is that their children are coming into the hospital with a Kawasaki-like picture. Kawasaki is a syndrome that was described by Dr. Kawasaki in Japan, and it is a constellation of symptoms. We don't have any definitive tests, but what it is it's a constellation of symptoms of 5 days of fever, relatively high, bulbar conjunctivitis, which means your eyes are very red. There's no discharge from your eyes with this. Cervical lymph node swelling, and a diffuse rash, and hands and palm swelling. And this really is a cascade of your immune system that attacks your body. And the big thing about Kawasaki is that it can attack it's a medium vessel disease, so it attacks the medium vessels of the heart. Mm-hmm. And what we're finding is that this is also happening in this new syndrome that we're pediatric multi-system inflammatory syndrome. And we're not calling it Kawasaki because it is acting differently than Kawasaki in that older children are affected. In Kawasaki, most of the children that were affected were under age 2, mm-hmm. And almost all of them under age 5. But this new PMIS is affecting children that are a little older, including teens. So that is something for people to watch out for. If your child has a rash and a fever that's lasting for more than 3 days, you should definitely seek help. There are blood tests that can kind of confirm it, or just like the same ones that we use in adults, the cedrate, the C-reactive protein, the procalcitonin, the D-dimer, the ferritin, all the inflammatory markers. These are all elevated in these children.
Okay.
So the fact that this is striking children, and we talk about it striking their heart, is very alarming, I think, to everyone. And the only thing I have to say about it, it's still rare. I think the figure that I most recently saw quoted was in the Lancet journal was 1 in 1,000 children that have had COVID. And the other beautiful thing about it is that we do have treatment. It is treated the same as traditional Kawasaki, and we are seeing good results with that.
Good. Awesome. All right, good. We'll take questions afterwards. I'm pretty sure there's a few questions for you, Dr. Benzoni. At this point, I want to introduce Pat Rehmer. She's the Senior Vice President of the Behavioral Health Network of Hartford Healthcare. Pat?
Good morning. From a behavioral health perspective, we continue to see individuals that are looking mostly for support at this time. We are still seeing some increase in the number of calls of individuals and still doing evaluations for people who need treatment. There's been a lot in news in the last 24 hours about concerns about a huge spike in suicide as it relates to some of the social issues that people are experiencing, unemployment, being isolated, the issues that people are confronting every day right now. And so I think that we are watching closely. We do believe that there are things that can be done to intervene to try and keep those numbers from skyrocketing the way that it's predicted. And with that, I'm happy to take any questions that you have, and I'm sure the others are as well.
Brian Ditlake with Fox 61 for the behavioral questions. When we're seeing all of these increases in suicides, and what do we tell our viewers right now to help them ease into this pandemic at this moment? Because this is a serious topic for everyone as far as mental health goes.
Correct, it is, and I think that it's really very critical that people understand that there's help out there, there are resources out there. People should call if they are experiencing increased depression, which would be things like increased or decreased sleep, increased or decreased appetite, crying, feeling sad for a longer period of time than 2 weeks. But clearly, if somebody is having any thoughts of suicide, they should reach out and call. The Hartford Healthcare Behavioral Health Network is doing evaluations across the state, and we can do those virtually if people do not want to come into an office, but we also have the ability to do those face-to-face. For me, the most important issue for people who are experiencing suicide, depression, any of those things, is the issue of hope. We really have to give people hope that this can and will change. We don't know what it's going to look like, but that there are supports out there and that you will feel better. And so we want to help people do that.
And when you say huge spike, do we have any numbers per se of what we're seeing out there, or we just have the general over huge spike?
The national news is anticipating what they have said is about 75,000 suicides nationally. Again, I want to emphasize that that is without any intervention, and I think it's really incumbent on those of us that are behavioral health providers to ensure that we are out there saying that we are open and that we are ready to assist people.
Gotcha. Thank you. My next question is to Dr. Benzoni, if she's available, if she's still on the
Yes.
Zoom call.
Yes, I
Dr. Benzoni, just when it comes to these Kawasaki syndromes that we're seeing in children, this is very concerning to parents, but do you think this will affect us going back to school in the fall? With this type of symptom, I can imagine some parents don't want their kids, being in these crowded situations when going back to school.
I think that's a very good question, and it is definitely that's under consideration right now. I think we have to keep in mind, though, that this syndrome is relatively rare, and it's detected by antibodies, not the actual PCR. So the children are asymptomatic carriers for the most part, and it is unpredictable. Like, you never knew they had COVID by the time they developed it. So it's going to be kind of hard unless we do some active screening to keep, active screening for the active disease, to keep it out of the schools or to keep it out of the daycare settings.
Gotcha.
It is a scary risk. If the benefits of opening versus the benefits of staying closed, they're going to have to be weighed very carefully.
And just even going further and just diving into this, so just so we can understand, this is a post-infection type of syndrome. Do we see this before, like during the actual infection or afterwards?
It's after the actual infection. We have other diseases that act like this also, but this is just presenting so dramatically. Right now, it's your body's immune system turns on you. It's a hyper-stimulated immune system. And so all the inflammatory markers that come out to fight diseases they're coming out too strongly, and they're actually attacking the body. How this is. So it is after. You do not have active infection. You are not shedding at this time for the most part. Most of the children, when they do the actual PCR test, which is the nasal swab, are testing negative. It's their antibodies that are testing positive.
Gotcha. As time progresses, do you think it'll be, wise for states to consider just testing everyone, including children, just going forward?
I think it's an idea that's under consideration. We know so little still, and every day the situation changes. We, until, a month and a half ago, really thought children escaped scot-free from this, so it is constantly changing.
Thank you.
Hi, Pat Eaton-Rupp from the Associated Press. Not sure who's best to answer this, but can you talk about whether you're seeing patients who are waiting, who don't have COVID, have other conditions, and are waiting too long to come to the hospital, and are you seeing negative outcomes because of it, because people are scared to go to the hospital with, chest pain or whatever conditions, and how serious a problem is that?
I think that's a very good question, and it's an actual opportunity for us to talk about something that I really genuinely, I think all healthcare systems should really focus on right now. I think the healthcare system in general has been very focused on COVID-19, managing COVID-19, and rightfully so in the presence of a pandemic. But as we go forward, we're strongly looking at, and I think you should emphasize that, the hospital being a very safe place to resume business as usual, and in that everyone that needs to be seen in the hospital or in the healthcare system should consider the efforts that's been going in from a public health perspective, from an infection prevention perspective, from a medical clinical perspective, from a psychiatric perspective, psychiatric management perspective. The hospital is still the best place to be if you have these symptoms. In data in regards to, have we seen an uptick in conditions such as you said before, cardiovascular injury? There's some data out. It's still too early to compile all those data and come up with a conclusion. I think our best guess would be there's some impact. I would say there's definitely some impact. When you think about healthcare resource, there's a finite amount of resource, and we've moved a lot of those resources over the last few months in order to facilitate this disease process. So I would be shocked if there hasn't been an impact. The exact numbers I don't know, but what I do want to stress is the fact that healthcare systems, Hartford Healthcare has put a lot of effort, and we've put a significant amount of thought in ensuring that hospitals are a very safe place to go, and as soon as the doors are fully open to elective surgery and elective procedures, this should be the first stop for anyone that has any condition, that hasn't visited the hospital in a period of time, that needed to visit the hospital, hasn't visited with their PCP. So reach out, get in contact with your PCP, set appointments, set up time to have those critical discussions about your health with your PCP. That, to me, is one of our biggest and strongest message that needs to be right now. Another thing, too, that I want to just, Dr. Benzoni, if you don't mind, if you're still on, the key symptoms for parents to look for, like what are the key symptoms, and just the mere fact that as soon as these symptoms are available, what are there or present, what should parents do? Like how quickly should they act, what should they do, and what should be the expectation?
Okay. So I had this question posed to me by a patient yesterday. She had a 2-year-old daughter that had fever for 3 days, a little abdominal discomfort, decreased appetite. And I did tell them that they should get blood work done. They didn't need to run to the emergency room. I think that could be done as an outpatient. And then if any of the inflammatory markers come back positive, we would refer this child to a hospital, children's hospital. I do think that 2 to 3 days of fever right now, especially with social distancing and not interacting with other children, you need to think of COVID.
Good.
And a rash. I would say 2 things: fever, rash, belly pain. Pick one of you. If you have 2 of those type of symptoms, you should seek some type of help. Call your doctor. See if you can get lab work done. We may be doing a few unnecessary tests to save a few lives.
Good, absolutely. And then there is treatment, as you said before, right?
Yes, the same treatment we use for Kawasaki, IVIG, aspirin, and steroids.
Absolutely. So early symptoms, seek medical attention as soon as possible, and the quicker we see it, the better we can treat it, right?
That's
awesome.
right, and the more likely you are to prevent the sequelae of the coronary ectasia or the aneurysm that can happen from the medium vessel vasculitis that this produces.
Perfect. Thank you so much. Any other questions?
Yeah, it's Pat again from the AP. I have one more. If you could talk a little bit about nursing home transfers, do you know what percentage of the patients in your system are transfers from nursing home? Has that gone down at a slower rate than overall patients hospitalized for COVID?
I think nursing home data is very challenging. So the data is available. The specifics on the data, I know, but I don't. Obviously, if I kept all the data, I within myself would be pretty shocked. But I can tell you, nursing home has been a concern from the onset of this. We have a good affiliation, a number of collaborative efforts throughout the states. A lot of the collaborative effort being led by Hartford Healthcare System to work with the nursing homes to ensure that the appropriate infection prevention practices are in place, to ensure that there's sufficient testing, not just for residents and patients, but also for staff as well. In regards to the data itself, I can try to ensure that the next time I'm here, I have that specific number. But there's a number of patients. It was very, very concerning. I think at one point, over 70% of the nursing homes within Connecticut had a positive patient. And some nursing homes, there's a few nursing homes that had over 40% of their population positive. Again, very, very concerned data. It's a very high-risk population, high vulnerability for this disease process. Hopefully, I'm sorry I didn't answer the specific to the question, but hopefully that gives you some information.
Yeah, I'm just more interested in your hospital and in your health system. How many of the patients you actually have at Hartford Hospital or other hospitals have been transferred from nursing homes? In other words, is it the majority of patients that are hospitalized are from nursing homes, or are most of them from the general public?
Yeah, that I can answer. The majority is not from nursing homes.
Thank you.
Yep.
And last question from Fox 61 real quick. Do we have any children at your hospital or your hospital system that have this Kawasaki disease-like syndrome?
I would say no, but I know who else would have the exact answer to that. It's Dr. Benzoni. Dr. Benzoni, from my understanding right now, we don't, right?
That's correct. We do not. There are 2 hospitals in Connecticut that do have children with the pediatric multi-system inflammatory syndrome, but none of the hospitals within the HHC&G or Hartford Healthcare System do have any.
Thank you, guys.
Good. Absolutely. Anything else? Okay.
We're getting a few on Facebook. Do you think Fairfield County is ready to open for business?
Oof. So that's a challenging question. So I can tell you from an epidemiological perspective, so Fairfield County right now, all the counties within Connecticut are seeing a decrease overall. It's the challenging thing for epidemiologists is what's the benchmark? So what's the number that you see that at that point you say, yes, it's okay to reopen? I think what the state did, the state looked at a number and say for the entire state based on a sustained decrease, and that decision will be made. And we've gotten to that point, a sustained decrease. So I think we're at that point to start having that discussion. There's a number of things that need to be in place, and I think the health systems are working really hard to ensure that those are available. Testing, for example, so availability of testing, easy availability of testing, and a steady supply of testing. And the other thing obviously has to be with working with community institutions such as restaurants per se, social institution, to ensure that social distance is embedded within the structure of society going forward. So I know it's a long-winded way to answer your question. I think from an epi perspective, based on the guidelines that Connecticut's been using, I think the state's in a good position to make that decision. But specifically for Fairfield County, I think if you look as Fairfield County within the entire cohort of Connecticut, I think Fairfield as well is in that position. Another challenging thing with Fairfield, obviously, with the close proximity with New York, so the epidemiology in Connecticut affects Fairfield or is reflective of Fairfield, but Fairfield also, you really have to look at epidemiology of New York as well. So complicated question, sorry.
We have another question. Some people think that wearing a mask is ridiculous. Can you explain once again why it is important to wear a mask?
Absolutely. So from a disease management perspective, very simple concept. So if I have the disease process and I'm having a conversation with basically anyone within 6 feet of me, I'm considered a significant risk to them. That risk is decreased significantly if someone step outside that 6 feet, outside of 8 feet, outside of 10 feet, it start reducing your risk. The risk is further decreased if I do what's considered source control. The source control is considered, I'm now considered the source of the disease. I'm also considered the vector, so the person that will carry it from wherever I picked it from and will pass it on to someone. So that source control that we've used is universal masking. So the masking actually prevent the movement of the virus from my respiratory system out into the environment, and then prevent it, by preventing that, the people that are around me now will not be exposed to that disease that I do have.
Another question for Dr. Benzoni. What's your professional opinion about opening schools?
I think that's a good question. My professional opinion is it's going to have to be done. I don't know if it's going to be done in limited steps, baby steps. Are we going to institute some type of screening at the door for the children? But remember that most children are asymptomatic carriers, so they may not even get a fever. Are we going to nasal swab all of them as they come into school? Because they'll be the active ones, and have a rapid screen. I practically think that that's not possible. I don't know if you've ever tried to do a nasal swab on a 5-year-old, but it's just not going to happen for the most part. So it's going to need to be more of a community-wide effort within the medical system, I think, rather than the school policing or detecting the virus. It's going to have to depend on the medical community to do that.
Another question, I have to get surgery in June and I'm nervous about COVID.
And you definitely should be nervous about COVID, and I think the nervousness that we've seen over the last few weeks have gotten us to the point where we can discuss reopening certain things, right? The fact that people have used that nervousness, that increased awareness, has gotten us to this point. Now, if the question is whether or not the hospitals are safe, I can tell you for Hartford Healthcare, we've put a significant amount of thought and effort into whether or not we're ready for reopening, and I think we're ready at this point. We're just waiting for conversations, obviously, from the state and for us to move forward. But the general question as to safety of the hospitals, I think, in general, overall in Connecticut are pretty safe. For Hartford Healthcare, I could tell you, we've done absolutely everything to ensure that there is utmost safety for staff, for the community, and definitely for the patients we're expecting again soon.
Another question, are hospitals going to test you before any surgical procedure?
Yes. So the expectation should be, if you have a procedure, any procedure, if you have an admission to the hospital, we will be working on, we at this point present, you're expected in your pre-op testing or your pre-op procedure, and your instructions that you will get from your surgeon and the surgeon's office is expect to be tested before the procedure. Yes, that's correct.
Have there been an increase in staff testing positive or getting sick?
There is an increase in staff testing positive, not an increase in staff getting sick. And I'll explain that. The reason why, there's obviously an increase in available testing. So the N has increased significantly. And there's a decrease in the criteria for testing. Because remember when this came out and there's a limited test, what we said was you had to have these specific symptoms in order to get tested. That's changed significantly. In fact, we're interested in anyone or everyone getting tested for a number of reasons, and Dr. Benzoni pointed out some key parts of those reasons. So there is an increase, but there's an increase because an epidemiological significant piece, which is the investigative piece of epidemiology, hence the increase in testing.
Can the staff that have been working in the COVID units get tested if they have the antibodies?
Can they get tested for the antibody?
Right.
Yes. So we're working on expanding our antibody testing platform. And the plan is to not just focusing on those staff, but to focus on high-risk staff area. There's a huge platform in working on testing for staff overall in the state of Connecticut. So there's a lot more coming out, but antibody testing and PCR is a part of the panel of testing that staff and everyone will have access to.
How are you testing for COVID? Is it a nasal swab? Is there any other way?
So currently we're using a nasal swab, and it's two different processes. There's a nasal pharyngeal swab, wherein a swab is passed through the nares and back to the back of the throat. And then there's the anterior nasal swab, where there is a basically swab just in the front or anterior portion of the nares.
And then one last question, I missed the beginning. How are the cases at Mid-State?
Oh, Mid-State currently is at 11 positive COVID and 14 PUIs.
Okay, that's it for Facebook.
Any other question, guys? I just want to thank Pat Rehmer and Dr. Benzoni, two experts in their field, to come on and help us with, I think, two significant things. Obviously, focusing on the fact that there's an increase in psychiatric disorders and an uptick, and that's something we really need to pay attention to. In that, seek help. Help is available. There's virtual help, and there's face-to-face. Just definitely, if there's anyone that's around you, anyone you know of, there's a number of hotlines that are available. Please seek help. Get help. This is a disease process that it's been magnified by, obviously, social distancing is a huge part of it. So we just want to make sure everyone know that there's help available. Reach out. And in regards to our pediatric population, obviously Dr. Benzoni spoke about the symptoms that we should look out for, and the quicker we get to that, the better it is for our pediatric population. There's treatment. The numbers are still small, but we're still very focused and very vigilant in ensuring that there's not a bigger impact. I have nothing else. All right. Thank you, guys. Enjoy your weekend.